It's the weekend. Be good to yourself. It's Katz's Corner with Dr. Aaron Katz and Dr. Philippa Cheatham, where you can get simple, straightforward answers to your questions about health, from diet and supplements to lifestyle changes. To reach Dr. Katz and Dr. Cheatham, call 800-848-WABC. Now, live on 77 WABC, the chairman of urology at Winthrop University Hospital in New York, with co-host Philippa Cheatham, attending in urology at Winthrop University Hospital. Here is Dr. Aaron Katz.
Good morning, everyone, and welcome again to another live round of Katz's Corner here on WABC Radio in New York. I'm your host, Dr. Aaron Katz, and we are here on this final Sunday of 2012. And so glad that you all could join us. We hope that you all had a wonderful holiday season. Good morning, Philippa. How are you?
Good morning. Here we are, almost 52 weeks of 2012 of Katz's Corner.
Yeah, it is remarkable, isn't it, that we did a show every week that we brought to the listeners. We didn't miss a single week, did we?
No, every week live as well.
And what we've decided to do today on this final Sunday of 2012, if you're just waking up, you're listening to Katz's Corner. We're here every Sunday. We bring you the latest and greatest in men's health. And, well, this past year, Philippa, we also did a lot of other things beyond men's health. And we've increased our listenership and our fan base. And we also want to remind the listeners, right, Philippa, that they can tune in every week to the podcast just in case they missed the show.
That's right. I mean, we have the live show and a lot of people tune in on the radio. But if you're out of New York or out of state, you can always pick us up anywhere in the world if you go to wabcradio.com. And, of course, for those who missed our live show, the podcast is always posted on the WABC website, so you can pick that up anytime, and it's there as an archive, living on for what we've talked about on previous shows.
And what's nice about the archive, too, is that each of the shows are there's descriptions about the shows. So if you have a particular interest, let's say that you have urinary difficulties, and we did a show this past year on the role of medical therapies for BPH, but also on the green light. We have specific, definitions and descriptions of each individual show.
That's right. The Library of Katz's Corner has helped a lot of patients and listeners. And, we celebrated our second birthday in May, so we're now into our third year, and hopefully we'll continue to have many years ahead of us.
Oh, absolutely. And before we continue on with this show, I think that we want to say some special thank yous out there, of course, to our loyal listeners and those that wake up every morning and listen to Katz's Corner every Sunday morning, that is, at 7 a.m., but also a special thanks to our producer in the studio, Mike Civilli, and our production assistant, Adam Gross. And each week we also see in the studio some radio colleagues and also some real friends and family of ours now, Mitch Levy, who does the news, and also our wonderful, the show that follows us, Religion on the Line, Joe Potasnik and Kevin McCormick, who we get to see after every show, and they're just wonderful people, aren't they?
They are, and they give us great feedback on the show every week and tell us what they found amusing. And I think they've become very well-informed listeners of Katz's Corner as well. Yeah,
and, actually they had us come on and talk about one area that crossed over between urology and religion, which is the role of circumcision. And we talked a little bit about that this year because there was some controversy, and there still is in the Academy of Pediatrics here in the United States and abroad about circumcision. However, we feel that there is enough evidence now that by having a circumcision, you reduce the incidence of not only sexually transmitted diseases in the future for young boys, but also the risk of urinary tract infections.
That's right.
And AIDS, actually.
That's right.
Yeah.
And they covered the subject really well, and also they came on to talk to us on Katz's Corner about the importance of religion in health and disease and how important it is for patients. Their faith can really help guide them through difficult times, and we try and talk about all issues, both medical and spiritual and emotional. I think these are very important issues for many patients, and particularly those patients with cancer.
Yeah, that was a terrific show that we had on how to add prayer and religion to help and to keep faith alive, especially when you're facing a difficult battle. And in fact, they were very it was a wonderful show when they had me come on and talk about my own experience with my son, Alex, and what I used when he was battling through his leukemia and had to have a bone marrow transplant last year. And how important really that is. And I think doctors, we don't put enough emphasis or talk to our patients about that enough.
And it's 6 months, I think, now since Alex has been through his bone marrow transplant and he's doing well. But you've had a very exciting year as well professionally, haven't you, with your new job at Winthrop?
Yeah, in February I signed on as the new chairman of urology, and it's been going great. We've been expanding the program, and this past year we had, again, our men's health seminar at the Garden City Hotel on Father's Day weekend, and we're going to continue to have that, Philippa. In fact, we can tell everyone now, because you're the co-director with me, and it's a wonderful day, the Saturday before Father's Day. We'll let everyone know, but we'll have the website up. But it's going to be Saturday, June 16th, 2013, at the Garden City Hotel. And this past year, we had not only aspects of, urological health, including sexual health and prostate health, but we also had some wonderful lectures about cardiac health and bone health at the seminar.
That's right, and the Garden City Hotel really did us proud last year, so definitely save the date, because we'll be back there this year on Saturday, June the 16th, and it's a great opportunity not just to talk to the experts, but also to talk to other people who've experienced a difficult journey with prostate cancer and the ups and downs. And it's a really great day, full day of lectures, and at the Garden City Hotel, not in a hospital environment, which I think was the right move, actually, to hold it at the Garden City Hotel. So hope you'll all be able to join us this year, and save the date. There'll be more information coming out on the whole seminar program in the shows in the new year.
Yeah, we'll talk about it as the weeks go on, but a wonderful event, not only for education, but also for the social aspect, for a lot of men and their spouses to come together and really speak to other guys that are going through a similar situation, and in the breakout sessions. And plus we have a lot of vendors there that are educating people about the integrative aspects of health. We had Quality of Life there talking about their mushroom products to enhance the immune system, and they've been great supporters of Katz's Corner as well. And
you set up the prostate cancer support group at Winthrop as well this year, didn't you?
Yeah, we have that. That's going on, and if you're interested, you can go on to winthrop.org and look on urology. We have the prostate cancer support group. We've had a few of our colleagues from Winthrop this past year. Dr. Johnny Haas, as you know, Philippa, he runs the CyberKnife program out there. And then one of our colleagues, Joe Jamal, who's a terrific robotic surgeon. We have some really terrific guys out there that do robotics if you need it, but there are some men that do. In fact, Joe Jamal, and there's another doctor, Dr. Dave Gershbaum, terrific guys, and really dedicated to getting the patient in and out of the hospital very quickly and back to an excellent quality of life.
Talking about robotics, I really enjoyed the show that we did with Dr. Manny Menon, who was really the founder of robotic surgery, and he flew in from Detroit to talk about his journey with robotic surgery, and it was fascinating when he was telling the story about how his wife thought it was initially crazy to do laparoscopic surgery, and how he went on his own journey. I mean, that was a great show.
Yeah, and we were proud also to have him as our speaker for the John Mordente Memorialship Lecture. We ran a CME program for doctors. There were about 60 doctors that attended out at Bethpage, and he gave one of the keynote addresses on robotic surgery in honor of one of our faculty that passed away at a very young age, Dr. John Mordente, this past year. Unfortunately, I never knew him. He passed away just as I had became chairman there this past February. But from everyone that I had spoken to at the hospital, there were only wonderful things to say about him, not only as a physician and extremely caring, but also as a family man, as an individual.
No, it was a very special day, and it was great to be able to honour all the hard work that John had done in urology, and to see his colleagues speak so highly of him. It was interesting with one of the key highlights, I thought, of Katz's Corner was how this issue with the task force's decision recommending against PSA screening caused so much confusion for our listeners and for patients, and also for many urologists in the community. And I thought that was one of the real key points about Katz's Corner, that we were able to address listeners' concerns.
Yeah, you're absolutely right. And, we feel, as many of our guests have come on, and also these are, experts in the field have stated that the task force really got it wrong, that it shouldn't have been to stop PSA testing, but we should have focused more on maybe trying to select patients for treatment, because we definitely overtreat many of these men in the United States with prostate cancer. And many of them, if we talked about, every week here on Katz's Corner, Philippa, is, going on to active holistic surveillance or using the holistic methods, even if you do need surgery or radiation, to enhance the effects of radiation or surgery. But you're absolutely right. The task force did get it wrong, and we spent a significant amount of shows this past year talking about that controversy.
And I think that's a great opportunity to say thank you to John Hass and Dan Petrolak. John is a radiation oncologist and Dan Petrolak is a medical oncologist, and they unanimously agreed with us about this task force decision, and we put together a great show. So if anybody wants to go back and listen to the show on the task force decision, or if you want to call Katz's Corner in the future, if you have a concern about PSA issues, we're here to take your call live on the air and help you work through those issues.
One of the other areas of controversy, I think, is the whole question of whether or not men with prostate cancer can get testosterone back. And to answer that question, because a lot of our listeners said, hey, there's a guy up at Harvard, Abe Morgenthaler, and he's an expert. He wrote a book on testosterone replacement. Get him on the show. And that's exactly what we did.
That's right.
We listened here to the audience, and they said, we need to hear more about this. And you and I were both really fascinated and got a great education, as did the listeners, that men with prostate cancer can now receive, with reasonable safety, I think, testosterone replacement therapy.
And I think PSA issues and issues with sexual health and testosterone are probably the top two calls that we get on Katz's Corner, so it was great to be able to address that. We also even did a show on a condition called Peyronie's disease, which is a condition that can affect the sort of penile anatomy and a diagnosis that's actually quite common, and we did a great show on that. And I thank my colleague from the UK, an andrologist called Dr. Munier, who called in and explained to the listeners what Peyronie's disease is.
Which is that curve of the penis, and it's frightening for many guys. You want to. You want to function in a straight way, without getting too graphic here on the radio. But there is this condition which does affect a lot of men and can prevent sexual function. And there is, thankfully, a lot of treatment for this. And he really educated the listeners about that.
He did. And what was interesting about that condition, like so many conditions that we deal with, was the association with heart disease, with the amount of alcohol you drink, with smoking. And, we had a great show that you ran talking to the cardiologist from Winthrop about how heart health and prostate health are often related. And, heart disease is the number one killer along with cancer, and it was great that we could address that. And it was very, very fun to see one of the Winthrop cardiologists getting the message across to patients at the seminar by giving his whole lecture on his bicycle on the stage.
Remember what we said, Philippa, the penis is the window to the heart. and we learned a lot about that, that if you're starting to have problems with sexual function, with erections, you need to check your cholesterol, as he pointed out. And it could be a sign that there is some underlying cardiovascular disease, even in men in their, 50s and 60s. So it was a very important talk. And Kevin Marzo did a terrific job. He's chief of cardiology at Winthrop, a terrific guy. And I think we're going to have him back at the seminar this year.
And Kevin also pointed out what we see in the practice, that sometimes patients present first with impotence, erectile dysfunction, as the first warning sign about heart disease. So it's not just a question of shelling out Viagra and telling the patient, good luck with that, but to really screen them for blood pressure, cholesterol, diabetes. These are very relevant issues.
Yeah, and then there were this whole bunch of shows that we did with Dan Petrolak, talking, some of them he came on and talked about the role of some of the newer medical therapies that have come out, because there is a lot of confusion about all these new drugs that in the last couple of years got FDA approval. How do we use them? What are their side effects? Are they going to impact on survival? And Dan, who was at Columbia, now moved up to Yale. I'm sure that we'll have him on again. He was one of our speakers, as you know, at the CME program at Bethpage, and really an international expert, and gave our listeners a lot of the new information about these medications.
That's right. Dan educated us about how Provenge works, the prostate cancer vaccine. We also talked about the drug abiraterone, which is an oral medication called Zytiga, which has helped a lot of men with advanced prostate cancer. And then at the end of August of this year, we had approval for this new drug, MDV 3100, another oral medication that's being used in advanced prostate cancer. And I'm sure that in 2013 we're going to see many of these drugs like Zytiga and like MDV-3100 that are currently in clinical trials. Hopefully they will get FDA approval and there'll be more treatment options out there for men with advanced disease. And talking about advanced disease, we had some very special stories and from patients with prostate cancer telling their story to our listeners. One of our patients came on with his wife, Mr. and Mrs. Pruger, talked about their 20-year journey with prostate cancer. It was a very emotional story, and many people emailed me who'd recently been diagnosed to say that show really gave them hope. And also we had Bruce Meeks, if you remember,
Sure.
who was a gentleman with early-stage prostate cancer, talking about his diagnosis and how emotional his journey had been.
Absolutely, because he's he's in his 50s, African-American man, and was recommended to go through immediate surgery, and instead went on to the active holistic approach and really decided to take this disease into himself and control it using herbs and diet, and he's doing beautifully. And he was really very emotional, as you said, almost breaking down when he got the diagnosis, but how much it has changed his life almost to the better, because he feels better now and much healthier now than he was before the diagnosis.
Sure, and talking about Bruce, who's in his 50s, who actually looks like he's in his late 30s.
Yeah, he looks great.
I wanted to bring up Gabe Canales again, because Gabe is a gentleman who was diagnosed with prostate cancer when he was 35, and he's done tremendous work through his charity, bluecure.com, to educate. He goes into schools and talks to teenage boys about prostate cancer prevention, and he talks about how we can prevent prostate cancer when men are still boys. And I think I would like to see much more emphasis on prostate cancer prevention in 2013, and you've done great work educating men about the role of holistics, diet, supplements. So for the young listeners out there, go to bluecure.com and have a look at Gabe's website, because there's a terrific amount of information there to help you talk to your sons and brothers about prostate cancer.
Yeah, and we also had another show in the last few weeks with Dr. Steve Cianti up from Boston. He runs the Boston group there, talking about the role of HIFU. And we mentioned on the show that we are now one of the centers for the clinical trial of HIFU in men that have had a recurrence after radiation therapy. This is one of the newer forms. As he explained during the show, Philippa, he gave a terrific description of how this works, almost like a magnifying glass with the sun rays going through the magnifying glass and directing it to a single point within the prostate. And now we can start doing much more focal therapy, an area that I think has great promise. And I think that this HIFU is very exciting.
That's it. The HIFU is the focused ultrasound that you've just described. And I think we'll probably see much more of this in the coming years, with minimally invasive therapies attracting a lot more attention and interest for patients. And Steve's got a huge series, and he's been doing this now for nearly 10 years, and it was great to have him on the show as well.
Yeah, I'd like to bring him down, too, for the Garden City Hotel seminar this Father's Day, because I think a lot of guys need to know. He also talks about imaging and how we can now use the MRI that men get and fuse that with the ultrasound and do a much more directed or targeted biopsy rather than the old-fashioned sampling, that random sampling. We can target these particular lesions.
And we need these colleagues to keep us up to date as well. The listeners are trying to keep up to date, but it's an ongoing thing. And, September was Prostate Cancer Awareness Month, and we did 4 sessions of Katz's Corner where we didn't have a guest in the studio, but we did a live Q&A for all our listeners to ring in, and many people called with questions about PSA and prostate cancer concern, which just shows you how many people really want this information.
Yeah, they do. They need it. And, time and time again, each week, we hear stories of men that were kind of pushed into having an unnecessary biopsy or pushed into having unnecessary treatment. And that's why what we're trying to do here every week is to give you the latest and greatest, and we hope that you'll tune in and continue to tune in. And beyond just the prostate, every once in a while, Philippa, we put in a show that's not below the belt. And, recently we had an excellent show by with the Begains, the Molly Fund, skin cancer show, which was just a few weeks. And if you missed that show, I would encourage you to go on to the podcast, because we also brought in a wonderful oncologist from Memorial Sloan Kettering who is, doing a lot of research and clinical trials on advanced skin cancer. And I thought that was a very worthwhile show to have.
It was a great show, and their website, which is mollysfund.org, goes through the ABCD of melanoma diagnosis, and it gives listeners information on how to look for suspicious lesions in moles and how to get advice to make sure that this is not a melanoma. And they've done a huge amount in the community, giving out hats and sunscreen advice and really great information, which all came about as a result of their 20-year-old daughter dying of melanoma. And they've channeled that very tragic story into a very positive thing by setting up Molly's Fund. And I agree, it was a fantastic show.
Yeah, I mean, I really congratulate them, and it's wonderful to see that, you know, unfortunately, they had a terrible tragedy in their life. They lost their young daughter to a terrible disease, but they've channeled it into something that's constructive, something that's really helpful to so many other people out there, because this information needs to get out there, because as we heard, melanoma is on the rise, and skin cancer is the number one cancer in all men and women right now.
That's right, and you associate that with fairer skinned, but they told us about Bob Marley, who died of skin cancer, which was a big surprise.
Yeah, that was. So that was a great show. We also had some shows, as you mentioned, on cardiology. And then we had an interesting show on colonics and the role of colonics. And, well, why don't you tell us about your experience there? Because I don't know if people didn't tune in, but there was...
Well, that's right. We did a show about colon hydrotherapy, and a very topical show, actually, for people who live in New York who are very keen enthusiasts, actually, of colonic therapy. And I was overwhelmed by how many people called in on the live board. We took all sorts of questions. We also used the show not only to address the pros and cons and the evidence for colonic therapy, but also to educate listeners about the warning signs of colon cancer, and to encourage people over the age of 50 to get their screening colonoscopy. I won't put you on the spot and ask you if you've done your screening colonoscopy.
I have not done, and I should. You're absolutely right, and I'm behind that. And at the age of 50, you should do that, and I'm overdue for that.
So just remember, when we do our recap of what we did in 2013, I hope to see your good news about your screening colonoscopy, giving you the all clear.
Well, now, and we made a big announcement, or I made a big announcement this year as well in the last few weeks, that Dr. Philippa Cheetham will be joining me at Winthrop University Hospital in the Department of Urology. She is my first official recruit, and she'll be seeing patients here in New York City on 944 Park Avenue, as well as in Garden City. So now that I have someone that can cross-cover for me, if I have the colonoscopy, Philippa, will you cover me during that period?
I'll cover you, and if you ever need any urological input, if you ever need your prostate operated on or biopsy, then...
You're handling that?
It would be very awkward, I think, for you to go to any other urologist.
Well...
Especially as I'm your first recruit.
Well, listen, I know that I said this on the day, but I'm so... excited that you're going to be joining the team at Winthrop. We have an outstanding team, and you're only going to continue to make it and grow it much bigger than it ever was.
And I would like to thank Winthrop Hospital for giving us the opportunity to see patients in Manhattan at 944 Park Avenue, because many of your patients came from Columbia and stuck with you, and many of the patients that I've met and cared for over the last 4 years have expressed an interest. So it's great that we'll be able to see patients both in Garden City and Park Avenue together.
Yeah, and we've seen the integration of medicine and media. We do this show every week, but to give you a plug, Philippa, I mean, you've been asked on Fox now. You've done a lot of shows on Fox News talking about a variety of medical conditions.
Yes, I mean, I love the marriage between medicine and media. As you know, we sit in our office, we talk to patients on a one-to-one basis, addressing their concerns. But the media, both television and radio, really gives us a platform to educate the masses. And I've probably done over 150 shows now with Fox Television.
Fantastic.
And I've did a show recently on the Dr. Steve show talking about female urology problems. And I really think that it's a great opportunity to talk to people about sometimes potentially embarrassing issues. Urology brings up a lot of those issues that patients find difficult to talk about, but you and I talk about all the time, and it's great to be able to educate people.
Yeah, I mean, we talk about prostate issues, but there's a significant number of women with urological conditions that you're going to be taking care of at Winthrop, whether it be incontinence or bladder troubles. Bladder cancer does occur in women, right?
It does, and also these issues issues with incontinence, both for men and women. Not only does it affect your work if you're running in and out of the bathroom every 5 minutes, but also it can really affect people's relationships. Incontinence is an embarrassing topic, and there are many new treatment options out there, and sometimes just very simple lifestyle issues can really help improve patient symptoms. So it's great to be able to address that.
And we see that more and more with women that have had multiple pregnancies, right, or some type of pelvic surgery where urinary leakage can be a problem and can interfere with their life.
That's right. That's stress incontinence. If you cough, sneeze, laugh or lift and you have urinary problems, we also see a lot of people with overactive bladder and can now even treat that with Botox injections into the bladder, which is also something that I'd like to talk about in one of our shows coming up in the new year.
Well, we've signed on for another year here at WABC for 2013, so tell your friends and colleagues or people that you work with about the show, because that helps us to get the word out. We have increased our listenership quite a bit. We appreciate your support out there immensely, and we'll continue to come every week and on Sunday morning at 7 a.m. and be here with you.
And what do you think is going to be new in 2013, Aaron?
Well, I think that there's going to be other, medications that will come out. I'd like to see more work in the holistics area. I think that more work needs to be done there, Philippa. We'll probably see some more diagnostic modalities using the MRI and ultrasound for prostate cancer detection, and probably some really new novel techniques. What do you think?
Well, I'm certainly excited to see that many of the drugs for prostate cancer that are currently in clinical trials are tipped to get FDA approval in 2013. So I look forward to having Dr. Petrolak come back on the show and update us. And I think you're right. I think that there's definitely a move towards imaging prostates before we biopsy them. I'm sure that we'll hear a lot more about these new technologies, not just in robotics, which has been a huge leap forward, but also in the other technologies. And I think we're going to be busy keeping up to date.
Yeah, I couldn't agree. So listen, we're nearing the end of the show. We're nearing the end of the year. Well, I just want to thank you, Philippa, for all the work that you've done for this show behind the scenes. There's a lot of work that you do every week. Since I've taken on as chairman, it's difficult for me to do this, and I just show up sometimes, and you have everything all laid out, and the script's all here, and the sponsors all there, and I really want to thank you for being a terrific, not only co-host, a colleague, but a dear friend.
Thank you, and thank you to you for being so compliant and having the faith and trust in me to show up sometimes at a few minutes' notice, and we have a quick discussion before we go live on air. But the listeners have really helped both of us work as a team, give us great ideas. I'm always learning. I'm always keeping my eyes and ears open about great shows. But, if you're listening to the show and you want us to cover a topic, Katz's Corner is here for you. So if you have an idea, then give us a call on 1-800-848-9222 in the new year. And I'd like to say, Aaron, Happy New Year to you and your family, and Happy New Year to all of the listeners on Katz's Corner, and wish you all a happy, healthy 2013.
Thanks, Philippa. Same to you and your family, and to all of our Winthrop family out there. And also I'd like to thank Maureen Reagan, who's been very helpful for the show. She's been terrific and instrumental in getting you on to Winthrop, Saul Torres, John Collins, all of the administration at Winthrop that's been so supportive and will be supportive of you. That's it for the show, everyone. Have a wonderful, happy new year. And again, tune in. We love you. Tune in every week. This is Dr. Aaron Katz.